Let's talk some health news this morning, other health news, if you will. Our health reporter, Hernandez, is here with this topic. Good morning.
Hey, good morning, Owen. So the Centers for Disease Control and Prevention has updated its recommendations on the COVID-19 vaccines. They're now saying that those older than 65 and people that are immunocompromised can get a second bivalent booster shot. Now, joining me now is Dr. David Persse, Chief Medical Officer with the City of Houston. Hey, good morning, Dr. Persse. Thank you so much for joining us.
Good morning, Haley. Good to talk to you again.
Good to see you. So, never in history can I imagine that we've ever paid so much attention to one vaccine, and then we've had to keep up with boosters and second boosters, and it's getting a little bit confusing for people. So what exactly is the benefit of this second booster shot?
Yeah, thanks. This does get very confusing, and I find myself having to go back and checking the charts to see what has changed since the last time. So what has changed this time is that the CDC has come out with a new bivalent booster shot that's available. They've recommended that people that are over the age of 65 and people who have immunocompromising conditions. So this includes people with long-term illnesses like perhaps diabetes, certainly people who are fighting cancer and are on chemotherapy, also people who are on immunosuppressive medications for organ transplants, people who have immunosystem compromises, and over 65 should get an additional bivalent vaccine at least 4 months after the previous one. And the reason for this is that as we age, our immune systems do two things. They don't respond as well to vaccines as they did when we were younger. And number two is they don't seem to retain that benefit from the vaccine. Because remember, what a vaccine does, all the vaccine does is it educates your immune system. It alerts your immune system. That's all that it does. And so as we get older, it becomes a little bit forgetful and it needs a reminder.
Okay, that's a good way to put it. Is there a chance that then these boosters could be extended to younger people?
So for right now, the recommendation is for kids that are 6 years of age and older, if they've never got a bivalent, they should, because the original monovalent, what it protects you against isn't around anymore. So really, if you're 6 years of age and over, then you should get at least one bivalent at some point. Now, for under 6, it becomes increasingly complicated, as you pointed out earlier, and you really need to talk with your pediatrician about your child's age, what other medical conditions they have going on, what allergies they may have. And so there are recommendations, but they're far more tailored. So I would recommend that parents of children who are 5 and younger, so less than 6, that they talk to their pediatrician to find out exactly where their child is and how to best protect them.
Yeah, I think all of us are going to have to go back to our pharmacies, go back to our doctors and say, am I caught up? There's been so much change over the last few years. And, is there ever a chance that we can say that we are up to date on vaccinations, or are we going to keep chasing this thing down the road?
Yeah, you're asking me to predict the future. What I think is going to happen is I think that the COVID vaccine will become similar to the flu vaccine, in that we will probably need an annual update for two reasons. One, we already discussed, that our immune systems tend to, forget after time. But number two is this virus is highly mutable. And we have seen how many different mutations, how many different versions of COVID we've seen just in the last 3 years. Mm-hmm. That is not likely to change. And so just like the flu virus, the reason you get a new flu shot every year is because the flu actually changes. It hangs out in the northern hemisphere in the winter. It goes down to the southern hemisphere in the summer. It changes a little. It comes back up. And the vaccine you got the year before doesn't protect you as well. So that's why we get annual flu vaccines, because the virus changes. We're going to see the same thing with COVID, I figure. That's what I'm anticipating.
Well, you always do an excellent job of describing that. But COVID cases are down. It's not on a lot of people's minds right now. In less than 3 weeks, the federal government plans to end the public health emergency. So how do you continue to encourage people, or should we continue to encourage people to get a COVID shot?
People are very smart, and through all of this, we've all become pretty educated on the basics of immunology and vaccinology. And what I think is people need to remember is that we still have COVID deaths in this community, very, very few, one a day maybe, or maybe even a little bit less. And these are not people who are dying because of something else and just happen to have COVID. There are still people who are dying because of COVID. They are almost exclusively, I would suggest conservatively, 85% or more of these people who are dying because of COVID today are people who never got vaccinated. They never got vaccinated at all. And so we do need to continue to protect ourselves. The virus hasn't gone away totally, nor has it lost its ability to make us really sick. the numbers are down because we have so much immunity in the community, whether from previous illness or from vaccine, that the numbers are low, but it's not gone. So don't kid yourself into thinking this is over. It's a whole lot better than it was, but it's not over. And it probably, like the flu, it probably will never completely go away.
All right, Dr. David Persse, a couple years ago when we were talking, we would have dreamed of the day when we talked about how few deaths there were in the community. So I appreciate hearing those words from your mouth, and I appreciate you joining me for this live conversation this morning. Thank you so much.
Thank you, Haley.